Good afternoon all, thanks for having me along today. My name's kjoy. I'm currently a student at Monash University undertaking the Graduate Diploma of Psychology, and today I'd like to talk to you about the use of taste aversion therapy for the treatment of alcoholism to produce a behavioural change. So in particular today I'd like to focus on a study undertaken in 1979 by Baker and Cannon. The study was published in the Behaviour Research and Therapy Journal and was titled Taste Aversion Therapy with Alcoholics, Techniques and Evidence of a Conditioned Response. Now, this study is important in the field of the use of taste aversion therapy to treat alcoholism, as it really provides an experimental basis for the use of taste aversion therapy. Previously there was a lot of anecdotal evidence suggesting that this was a effective therapy to use. However, there hadn't been many experiments undertaken in this field. So the rationale really for undertaking this study was that, as I said before, there was that anecdotal evidence that it was effective, but also other treatments such as the use of electric shock therapy was proving to be ineffective. So Baker and Cannon set out to look at whether the use of a chemical emetic, to elicit a conditioned response would be effective. That the use of taste aversion therapy could be used to elicit a biophysical conditioned response. And through this they suggested that they would see a change in heart rate, a change in skin conductance, as well as an increase in nausea. 2 participants volunteered for this study. Both were young males in their late 20s, and both, as I said, were volunteers, and they were both treated at the Salt Lake Veterans Administration Hospital Alcohol Treatment Unit. One of them was an inpatient at the facility and had a history of drinking for 13 years, which had really become concerning in the last 3 to 5 years. The other gentleman had been drinking heavily for a period of 5 years. Both of these participants had a history of difficulty with the law that was really associated with their alcoholism.